Welcome to the Point of Medicine podcast, brought to you by LearnNeuralTherapy.com. Doctors Ann Hill and Alana Gurbich team up to take a deep dive into the art and science of healing. This podcast explores cutting-edge approaches to the autonomic nervous system and its role in organizing fascia for optimal health. Each episode features conversations with leading clinicians who are pushing the boundaries of medicine, uncovering new insights, and transforming patient care. Join us as we bridge tradition and innovation to expand what's possible in modern healing. This podcast is for informational and educational purposes only and not intended as medical advice. Please consult your healthcare provider before making any changes to your medical plan.
Hey, everybody. Welcome back to the podcast. We have with us today Dr. Stephany González Linares. And Dr. Stephany is a medical doctor and a master in molecular medicine and a PhD candidate in social sciences and health. And she's currently a professor at the Faculty of Medicine and creator of the 360 Health Experience Method. She integrates regenerative medicine, neuroscience, and longevity in her clinical and organizational work. And she has over 15 years of experience and has co-founded wellness centers such as Soul Spring, Sanctuary, Allura, Longevity, and Avem Studio Blanco. And she currently leads the Return of Wellbeing and collaborates with Ethos Baja, which is a longevity retreat center, which we're going to be asking her all about today. And she advises in international projects in wellness, longevity, and regenerative leadership. And Dr. Stephany works in Mexico City. So, and we know her very well through our neurotherapy world. So we wanted to say hi and learn a little bit more about what she does today. So, hi.
Hi, thank you so much.
Thank you. This
Thank
was,
you for
just so
the
everybody
intro.
knows, this was a monumentous feat to get the three of us together in the same time zone, in the same place. So I'm happy that it finally came to be.
Yay.
It's happening.
So, Dr. Stephany, tell us a little bit about yourself. Who are you? What's your focus?
Good. Well, more than focus, I'm going to tell you a little personal story. When I reached the neurotherapy world and the healing world, it wasn't because I wanted to, but it was because that was the only chance I had to heal. So I became a healer because I needed to create something that could help me heal and then offer it to the world. So since then, I had a very bad spinal lesion. I had an accident and I had cervical trauma and concussion, all of the possible diagnoses with the most terrible outcomes possible. So allopathic medicine wasn't giving me solutions. They were telling me I would lose my hearing. I would always be with tinnitus and vertigo and would always have pain, like chronic pain, like just like a death sentence. And that probably I would never be able to play the piano. I would never be a mom. I would like everything like really, really fatalistic, but something within me, and I was already a doctor, a medical doctor in Mexico, and something was always there, a curiosity to not settle and not think that the medicine that existed was all there was forever. So thankfully, I heard that voice and and that spiritual kind of call to keep looking for answers. And I was already studying neurotherapy. I had finished my master's degree and I was already doing my diploma in neurotherapy. And I remember that somewhere between all the vertigo and the sounds and the pain and all the confusion, I felt the urge to get better just to prove to the world that this wasn't a death sentence. So that's how I think my second healing path started. The first one was a conscious decision to become a doctor, a physician, to follow this path, to study medicine, to go through every scientific way of becoming possible. But then I feel that the second wake-up call was a real one when I truly became a healer.
How old were you?
How old am I?
How old were you when you had the trauma?
How old were that was 8 years ago.
Wow.
Yeah. I'm 40. I just turned 40 last week.
Happy birthday.
Happy
birthday,
And so you had already discovered neurotherapy. You were already learning about it. How did you discover it to start with?
This was very funny because I discovered it as a patient when I was in high school. No, junior high, for in junior high. I had a teacher that she was my math teacher, and she saw that every time I had an exam, I would just like But she knew I wasn't pretending that I was sick. I was actually having like stomach pain continuously. And one day she said, I know you're very smart. I know you're making an effort, but why don't you get better? I said, I don't know. Like I continuously have this pain and sometimes have vomit. It looked like typhoid fever, salmonella, something very strange. And she said, why don't you go see my sister? My sister is a doctor, but she's a very special doctor, and she healed from her brain and she does neurotherapy. I was like, I don't know what that is, but you can tell my dad. So my dad took the number and he took me that day with Dr. Julissa Maldonado, who you probably know her. And that time she was practicing very close to my parents' house. And I told her what happened and she laughed. She said, I thought you had something very difficult to heal. This is just like one injection and you'll be okay. Go do your exam because my sister's gonna fail you if you're not back in schools. She gave me two injections. I said, okay, is that it? Yeah, I'll come back in 2-3 weeks, but you'll be okay. And I asked Dad, like, wow, if this really works, because this is not antibiotics, this is not something super profound that I just have to keep coming. I need to study this. And he said, of course, first you have to go through med school and then ask Dr. Julissa, like, how did she get there? I was like, of course I'm doing it. This was junior high. And then I started hearing stories of similar cases where she just gave one injection in the abdomen, in the belly button. People were healing and also my classmates were healing. And I didn't know this was possible. So, of course, like I developed a curiosity, a very, very deep curiosity, but I was 15, 16, and I couldn't study them. But then I started reading a lot about neurotherapy, nervous system, and I had the blessing that my father was living in Taiwan back then. So I had an introduction to Chinese traditional medicine, actual traditional medicine. And then we traveled all over the world because he's a pilot. And this is how I started seeing the whole world that was beyond hospitals and beyond allopathic medicine. And of course, ever since day one, I started med school when I was 17. I was very young. I was very smart, very curious back then. And when I started med school, I said, I don't want any regular specialty. I'm not interested in surgery or emergencies. I know I have to go through that because it's part of my formation, but I want to do alternative, complementary medicine and neurotherapy. And all the doctors were laughing. Of course, they were like, what's that? Like, if we don't have it in medical school, it doesn't exist. And that was a big part of the journey, just having to prove that there was something beyond. And when I finished med school, I wanted to go deeper. So this is why I studied my postgraduate in molecular medicine, alternative complementary medicine, and neurotherapy.
Wow. Can you tell us, I'm always just curious about with other countries, like how many neural therapists are there in Mexico? And sounds like it's like here where like Western medicine doesn't really accept it as like a real thing. But where did you get training and like how many people in Mexico are really doing neural therapy and complementary medicine?
Well, in Mexico, so we are a hybrid. So I'm going to talk first about complementary and alternative medicine. Since we do have a very big background of traditional Mexican medicine that involves plant healing, spiritual healing, and all these modalities, for us, it's kind of intertwined with the health system, although mainstream medicine doesn't consider it as important as regular pharmacology or other therapies. And in Mexico, alternative medicine comes from Europe, most of the approaches. Well, Europe or Asian traditional medicine, we don't have yet developed like our own system and our own culture where we can bring other specialists from all over the world, the way that we go study to India and to China or to Taiwan for our traditional medicines. And the number is very big. In 2013, there was a law reform that included these services for vulnerable communities, for example, because it's cheaper, it's way more accessible. People in Mexico are more familiar with plant medicine, with ceremonies, with spiritual healing, with all these intersections than with allopathic traditional medicine. And also it's not as available as plant medicine. And for neurotherapy, when I studied in Mexico, my first kind of diploma course, the first course, this was in 2010. And I believe we were like the 6th or 7th generation. Before that, people would have to go to Germany or to Spain or to Colombia to study with the masters, with neurotherapy founders. But then after that, we started growing, and I feel there was like a threshold where this institute just opened up the way for more holistic practitioners and for people like me that were eager to learn, but also to build community and to join all the other associations to be able to not just do neurotherapy, but go beyond. So I was a co-founder for the Mexican Academy of Neurotherapy and Integrative Medicine, and we have over 600 practitioners registered, MD, and there must be like maybe 50, 60 DS, and we still have very few vets. We hope we have more vets that can become neurotherapists, but it's not as rare in Mexico anymore.
Well,
And
that's wonderful. Yeah.
it's after you finish your medical degree, you can get a certification to do neurotherapy. Is that how it works?
Yeah, we can in Mexico only MD, the DS, a dental
Deal.
specialist, and veterinarians are allowed to practice neurotherapy. We don't have a kind of a legal classification like in the US for naturopath or these. It basically separates people from people who can inject and people who cannot inject. Not
Yeah. We have every state is really different here for who can inject and who cannot. So, can you tell us a little bit about your practice? Like, what kind of patients do you see? And I know that you like to, like, we're talking a little bit about really focusing on mental health. What does your practice look like? And um, tell us all about that.
yeah. So after I discovered that I could start healing after the accident, I was very curious and I just needed to study neurosciences and I knew I didn't want to become a psychiatrist or a neurologist because that would mean going into the allopathic world, hospitals, pills, and I just didn't want that. I just wanted to go to the root cause. And so I started discovering this world of neurosciences, applied neurosciences, nervous system, healing, and I discovered a whole new world where I could do regenerative synergies using what I knew with molecular medicine, plant medicine, extracts, homeopathy, and all these complementary therapies together with neurotherapy and nervous system regulation. And this took me to a very, very interesting part where I became a researcher in neurotherapy and specialized in HRV, in heart rate variability and coherence. This to me became a very big turning point because it was going beyond seeing one by one in the clinic to massive to reaching thousands, millions of people through our work. And so my practice has been going on for 15 years, where I had the chance also to teach as a professor in the Faculty of Medicine, to teach in postgraduate studies. And now what I figured is that if we don't reach masses, we're never gonna reach the mental health epidemic. That's 2030. We're already there. There's so many cases sprouting every day, mental health imbalances that don't even look like depression, anxiety, PTSD anymore. They are just this very complex mix of symptoms together with social changes, together with world changes, together with hormonal imbalances, immunological changes, all this switch that is impacting people all over the world. So my practice became more than a one-on-one session. We started serving groups. We started going into companies because this is where people spend most of their life. People spend more time now in companies in their office and with their coworkers at home with their families. So I thought if we don't take these services that we know that they're working because we have clinical research, we see the clinical outcomes, we're successful also in business. So why don't we take this to people who need it the most? And for me, that was with leaders and in companies, because if we don't switch the way nervous systems are regulated and leaders are regulated, then the impact is going to be it's going to be a disaster, I feel. So we started working with companies like Google, like Rotoplas, like pharmacies, headquarters here in Mexico City, and the results that we saw were impressive because leaders were shifting the way they showed up for their colleagues, for their collaborators, and this elevated the frequency. This created healthier environments. People were sleeping better. People were more aware of their health, more aware of what they're eating, what they're thinking, what they're breathing. And suddenly, this became a shift in my paradigm. So I stopped being a doctor, a regular doctor, a neuroscientist, well, alternative doctor, to become something like a business healer, where now we do have our practice in Mexico City. It's a very uncommon way of having a healing sanctuary because it's in the middle of a mall, of the busiest mall in Latin America. We have more than 30,000 people coming and going every day in those buildings in the area, most of them with burnout, insomnia, sleeping disorders, every type of mental health disorder um, due to work-life balance or balance. And so in this practice, we do longevity basically because this is a focus of not just not aging, but making sure that the years that we're living are the healthiest as possible. At the same time, we created this offering for serving companies that were ready for transformation, where otherwise they wouldn't look for this type of health. Otherwise, they would never know what neural therapy is, what autonomic nervous system regulation is, what exosomes, stem cells, peptides, because they would never look for that health. So we're thinking, and we want to see it like we're kind of these Avengers that come into the company and shift the brain from burnout to success, but also allowing for way better health that they would expect.
What does a program like that look like? So if a company signs up to work with you guys, you see the staff weekly, monthly, they do retreats. What does that look like?
So it's custom made suit. We do need a diagnose. We do need the leaders to be open to transformation. There are a lot of companies, banks and tech companies that want to sell more, but they're not ready to invest in their transformation. And this means that they're not ready to open their hearts and be in coherence. So first of all, we need the companies and the leaders to be ready, and we do diagnose through HRV and neurophysiological patterns. So we use 3 devices. We go into the company when we use two areas. One is cultural shift. We understand what the company wants, what they're based on, if they do have culture, if they do have inner really self-awareness. At the same time, we do all these neurophysiological assessments, and then we have an average of HRV, we have an average of SDNN, we have an average of all these metrics that tell us how healthy the person is, how resilient, how much the person is coping to stress. And then this average creates like an overall brain, and we can biochart this and track if the company is ready or not for transformation, if they're degenerating or regenerating, if the brain is blue in maximum top performance, or if the brain is red in survival mode and inflammation. Surprisingly, companies work with very little awareness about this, and most of them are working with a survival brain. And this means that they don't see all the opportunities possible. Their brain waves are not the healthiest way. They're basically on delta waves, and individuals are not sleeping, they're not creative, they're not open, and their systems are not regulated. So once we have this, we present this information to a company to bring awareness. And we do this on a in-person session where also we have a business partner that does all the marketing and culture and all the inspiration that comes with that. We give a conference. We give 2 conferences. One that's about bringing life to brands, bringing life to companies, bringing consciousness to companies. And the other session is what the body expresses when the mind is not in balance. When we put these together, shift starts happening, and all the collaborators say, I want to do this, I want to change, now I see, and their HRVs start changing and they become more open. And then we do a custom-made program. We do mentorships 2-on-1 online. This is a program that makes sure that we do stress scoping and we identify areas where the person can work on themselves, like sleep, lifestyle, nutrition, and the 5 pillars of lifestyle medicine. This is what it's based on. And then we do neurophysiological and neuroenhancement trainings. This happens in person, and we use 3 devices. Neurofeedback in real time. This brings a person to a bigger awareness that their brainwaves are not functioning. It's not their fault, but like if brainwaves are not functioning, it's like having a radio station out of sync. And then we do a gauge, a brain fitness exercise where we can see neuroplasticity, we can see focus, we can see if the brain is tired or if they have any other metabolic imbalance or anything else that we can train. And the third one is a passive brain tapping. This brings a reconnection to both hemispheres, And it's like magic. I know it's science, it's neuroscience, but it's like magic. So shifts outside start happening while we're working on the brain. We're hacking the brain. Of course, we have a very big science behind this, but it feels like magic sometimes because we can see shifts in 2 or 3 days. And after that, the process is monthly or bi-monthly sessions. If we're in Mexico City, it's bi-monthly, but we work also remotely and with some companies in the US as well. If they're ready for the next shift and for the next upgrade, then we come in with exosomes, peptides, and regenerative medicine. And this is a huge, huge upgrade because most people won't see that they were so sick and tired and with brain fog and with so many issues until they change and until they receive all this process and they go, wow, like how did I miss this all my life? And then we do a kickoff session and a launch, and we compare what happened in baseline and what happened in month 3, 4 when we have the different brain. Every company has a shift in most individuals. There will be some, of course, that will fall behind. They probably won't follow lifestyle but it's minimum. Most of the groups really, really do change. We call it high frequency DNA because it's really the DNA of the organization that changes through epigenetic shifts in the individuals.
Wow.
Wow.
That's so interesting.
That's just a great concept because, of course, it's just like, yeah, that's what we kind of grapple with all the time is how can we bring more information to larger groups of people? And it totally makes sense that a company would have its own DNA for how it's run, and have its own, mental health issues. So that's really wonderful that you're doing that. Can you tell us about so you're doing the exosomes and the peptides too with injections. Can you tell us a little bit about that?
So this was when I was studying in 2010, my postgraduate studies in molecular medicine. This was only lab science, and I was looking at studies in mice, and I was like, wow, I can't wait until this is available for people. So now, 2025, it's available for people, at least in Mexico. We use human exosomes and stem cells and placenta-derived components. So what I saw is that HRV shifts can be very slow in Mexican or Latin American people when we have so much genetic baggage for inflammation and chronic disease. So it was getting hard to just do all these changes through lifestyle supplementation and neurotherapy. I feel that we do need like an upgrade and a shift and a lot of help in these. So we started combining regenerative therapies with autonomic nervous system regulation with neurohacking or neuroenhancement treatments. The results we saw were impressive because it doesn't matter where the interfering field is, where the person's most baggage in the biological systems are. Exosomes can communicate this, and they can go through the whole process to allow this to happen in a very natural way. So the process depends on where the person is. So we first take assessments, or we take an epigenetic test with hairs. We do it with 3 little hairs. So we send it to Germany, and they tell us what kind of toxins or what kind of stressors are mostly present in the person's system. And from then we do individualized plans. We don't go blindly over diet or lifestyle. We just go with the epigenetic test and with the HRV, brainwave, SCNN, and RMSSD assessments are telling us. And then we create a custom-made plan that's not so custom, but this is a 360 method. It involves mental health imbalance solutions, brain chemistry solutions, lifestyle, detox, and regeneration. So these are 5 steps that the person can take anywhere in the circle. Some people will come more for detox, some people will be ready for regeneration, some people will not be ready, and we have to bring the body to a readiness. And then we use PEMF, pulse electromagnetic frequencies. We use red light therapy. We use all these anti-inflammatory systems to just put the body into a calm, neutral state where it can receive the information. And then we either choose from stem cell or hybrid, which is a combination from stem cells with exosomes, either IV or localized with depending on the meridians or what the person has. This is really, really individualized and custom made as well. And we also used one of my favorite treatments that's nebulized inhalated exosome. This treatment goes directly to the brain. And since we are seeing a population that 70-80% of the population is now having neuroinflammation, silent neuroinflammation, we use it almost with every person, and the results we're seeing are impressive, even with people that have stroke, that have Alzheimer's, that have apparently non-reversible conditions, we're seeing shift. And after that, we close a program with peptides. Peptides are chosen depending on the main issue that brought the person to the system in the first place. So, for example, if we have someone that came for metabolic imbalances or hormonal issues, we will choose something that's derived from placenta, amniotic fluid. Or if we see a person that's very healthy or a top performer, CEOs, athletes, healers, leaders, that they have a very good overall health, but they want to be better, then we choose anti-aging peptides and protocols. If there's someone that has a combination, that had cancer but recovered, or had some autoimmune disease, then we choose a specific one.
Can you just describe, just for people who don't know, what is a peptide and what's a exosome?
Sure.
And what's a stem cell? Like, what's the difference between them?
So we have in Mexico, we have a very open world for these specialties right now in regenerative synergies and regenerative medicine. A stem cell treatment or cellular treatment can come from umbilical cord and placenta, human. We have special laboratories that have a process with hospitals. So instead of, I don't know in the US or other countries, but in Mexico, most placentas just are thrown away like garbage. And it's not garbage. It's one of the like fullest treasures in the world. So we have this where the mother can donate their placenta and umbilical cord for stem cell research and science. A part of it goes for research, a part of it comes back to the mom and the baby, and a part of it comes to patients, which is what we're basically doing. The difference is that a stem cell is a very unique intervention where the body decides where to put it or what to do with that information. The exosomes are very small vesicles that communicate
Vesicles. Yeah.
vesicles that communicate information from cells normally in the body. And what happens is where tissues are endangered or damaged, we stop having this good communication. So basically, organs and systems don't talk to each other or don't talk correctly. So they don't know if they have to regenerate or produce or break down. They don't know this information. So exosomes are very um, they're not new, but they're very innocuous. Like they cannot cause an allergy. They cannot cause, because they're not full cells. They're not full tissues. They're just communicating. And when we use these hybrids, and peptides are small chains of amino acids that, depending on the tissue or on the organ, the lab puts together special combinations so they can regenerate other tissues. And research is impressive so far. We have seen research papers on growing ear communication, on tendons, on brain, liver, almost at every target that 10 years ago we would never think that could be recovered, now is being recovered. And these are very unique ways of performing regenerative medicine. One of the most common questions that I hear is, why isn't everyone doing this? And why isn't every person getting stem cells and peptides and exosomes? And now I do feel that I'm becoming an activist for these therapies because the impact is very, very high. And for diseases that are very challenging and that can cause discapacity in a very short time, these are promising treatments, and they're not as new anymore. This research has been going on for a while, And of course, there will always, this is not a miracle, this is not for everyone. There will be contraindications for the treatments. There will be people who maybe cannot receive it, but these are very, very, very few compared to the benefit.
We have it available in the US, but it's so much worse quality than what you guys have in Mexico, because in the US, you can't get embryonic stem cells. You can self-harvest and send it to a lab to regrow it, which is very expensive, but you're also self-harvesting probably from an inflamed body. Or you can get embryonic stem cells that have been irradiated to make sure there's no viruses or anything. So again, the quality that's available in the US is drastically, drastically worse than the quality that you guys have available in Mexico. It's grossly different.
Wow.
Yeah,
Can you give us
legally, I'm sorry, we do have this this challenge and this opportunity in Mexico to become really this hub where in in the ancient times, people would come to Mexico and to Mexico City to heal, to regenerate, to use the steam baths, the mezcal, plant medicine, and people are coming to Mexico also to do other types of medicine and ceremonies and all this. And so I see that stem cell treatments and regenerative, not just stem cells, but regenerative treatments in general, are these synergies that are kind of coming back from this ancient wisdom that the body can heal itself, that we always have the resources available. And fortunately, we still have this very open. I hope it doesn't change in a while, but this is why we're also creating these hubs where people from the US or from any country can come to Mexico and heal through these benefits. Of course, it's more gentle than than other treatments, but it does take a toll, or not a toll, but it does take effort from the body. Um, Talking about common effects, fever and maybe anxiety and maybe we call it in Mexico crisis curativa. This happens with homeopathy and with some therapies where the
Healing
body doesn't get
crisis.
better, it
yeah.
gets worse, and then
Yeah.
it gets better. But this is because we're moving inflammation and depends on the level of toxins that the body is having. And of course, it depends on specialized professionals. We do need to study a lot. I mean, I studied my master's degree, my PhD, 2, 3 specialization certifications. It's not easy. It's really molecular biological medicine to the core. And unfortunately, there are also practitioners that are not doing it properly and causing maybe not side effects, but less effects than they should, or diluting. There's always like these two counterparts. But for me, this has been um, turning point also in my career, because now I don't have to tell the person like, okay, let's see how far neurotherapy goes, or let's see how far your supplements go. No, now we can target specifically the organ or the system that's not running well.
Can you give us like a good example of like a case that you really enjoyed working with, either a company or a human
No.
or a rat? Maybe a
Companies are
rat. I don't know.
human. Sure. I have so many in mind. I'm going to present this in the conference next week, a series of 7 cases. One a very impressive case was a person that had long COVID. He was both a leader, CEO, lawyer, very busy with long COVID, post-COVID, and he reported no sleep, like 2, 3 hours of sleep per night for the last 2 years. I said, I can't believe I can't believe you're talking to me. I wouldn't be talking to you. Like if I don't sleep 1, 2 nights, I can't talk to anyone. How can you do that? She said, my body's coping. I just wake up, have coffee, and just go to work. And he was never told that he could heal his lungs and his bronchia and his neuroinflammation. So first at the clinic, we had to go over the detox, hydration, also correct a lot of minerals. We're having a lot of issues, I think, all over the world with mineral depletion and protein depletion. So first, correct this hydration, correct nutrition. And then we started a journey of 3 days of inhalated exosomes. So his daughter texted us, and they said, like, I don't know if I should love you or hate you, but my father just took a trip to France. He was always waiting for this trip, and he was so scared that he would like get shortness of breath during the flight, but he felt so good the last days that he just took off, and he's going to come back in 2 weeks and continue the treatment. But he said he wanted to take this opportunity because this was the first time in years that he could actually breathe and that he felt like himself and he was sleeping. And
Wow.
so he just took this chance. This was very moving. And I have 2 personal stories as well of
Can I ask just a clarifying question?
Sure.
So I'm listening to that story, and in my brain, I'm thinking, okay, mineral nutrient deficient, but I'm also thinking chronic infection, Like, does chronic infections go into your thought process with these patients, or you guys are really just looking at the physiology and restoring the physiology?
You mean if we are testing for chronic infection?
Yeah, like, are you like, is it possible that he has some kind of bacterial changes or Lyme disease or some kind of viral overload? Like, how much is that coming into your differential when you're working with these chronic patients?
So we have, for us, it's epigenetic testing. We could go into a lot of functional tests. Yeah, I map this, map that, map. In my experience, it's not in the present moment because it takes about 6 weeks for the result to come back. So what we do is we test in real time with all the assessments and we do epigenetic testing, and then it tells us if the intestine is overloaded, if it has a viral signal, if where the viral signal is, and from there we take action. We're not just treating without root cause assessment. We're having a very broad clinical history, historia de vida, the story of life. We do take into consideration all the normal aspects of a clinical chart, and the tests that we do are mostly based on this real-time functioning.
And then what epigenetic testing are you doing?
Epigenetic testing.
What does that mean?
It means we take 3 hairs. The
Okay,
hair
that's the
follicle
hair.
has all the
Yeah.
genetic information.
Huh.
Yeah.
Interesting. And then
Yeah.
what's the turnaround time on that?
It feels like science fiction, but no,
Yeah.
it's all it goes- has all the genetic information, and from there we go a step beyond. If we keep treating what's physically available, like virus, bacteria, we can go over and over, and it's just a loop. If we go one step beyond to epigenetics, then we can change the actual issues that are causing these bacteria and viruses to stay there and live there.
Interesting. Huh. Alana. Oh, you looked like you were frozen. So I was like, hello, where are you? Um, okay. So there's the case of the long COVID uh, man, and then you had said that there was another case or something
But
that you
yeah,
were really
that was
interested in.
a
Yeah.
very fun case. This was a very personal case. This is my one of my aunts. She's 62, and she started getting stem cell treatments from me because she had thyroid disease, Hashimoto's, and she had candida and sort of symptoms all over the place that nobody could treat. And suddenly she decided that she wanted to live. She wanted to go into this longevity program. So we also did nebulized exosomes and stem cells. She went on a trip 2 days later. She did have a fever. She did hate me for 24 hours. She said, like, what is this? I'm anxious, I can't sleep, I'm sweating, it feels like I have menopause, like what happened? After 24 hours, she took her flight to Colombia. She's in the border in Mexico. And she sent me a picture just like this in the stairs of Montserrat. That's like 1,000 something staircase. I was like, wow, so have fun. And she said, like, no, you don't remember? I couldn't go up the stairs because I would have a shortness of breath immediately because I had an aneurysma and my lungs were so bad. She's like, this is not just like a funny picture. This is me healing my lungs in like a very, very, very fast way. I was like, oh wow, like I didn't know. And since she's my aunt, I said, no, but you're just cheering for me. You're giving me like a very impact, like a very big impact. She said, no, like really, you don't remember when you were little, but I couldn't go to some places with you because I would just had to stay and I got dizzy, something that looked like dysautonomia, and now I'm free. I could go everywhere. I love this. Tell me what to do. And most people come back with a very renewed way of saying like, okay, now I'm healed. I understood. Now what can I do for this? What can I do for other people? And this is something new for me. That it never happened before in my career. I mean, people would heal and thank me. People would say like, oh, I can sleep now. I don't have pain anymore. I don't have this anymore. But now it's like a different type of healing that brings people to cooperate, to collaborate, to give more, to give back. And this is so impressive for me. I do think that this has, in the energetic and holistic level, more in the meta level, for me, does have a different approach and a different imprint.
Wonderful.
Hmm.
Are you going to be, I know that you had done a class with our friend from Colombia, Dr. Bonilla. Are you going to be having any more seminars or trainings that we can let people know about? Or are you
Sure.
just, yeah,
Yeah, no, of course. We have to share this. We do need more practitioners understanding and also embodying the healer and embodying that we are the best for ourselves and then give it to our patients. So, starting next year, end of February, we're having an in-person, all-inclusive retreat for healers. This can be MDs, DS. I don't think we're having vets, veterinarians, but it's open for healers. And we're going to talk about biological medicine, regenerative synergies, and also we're going to give a master class on how to communicate this to the world. So it's marketing, culture, and business wise. How do you make sure that your art and your offering is sustainable and is well communicated so you can reach massive audiences? So this is happening for end of February next year in Mexico. We still have to decide if we want to go to Cancun or with one of our resorts or Mexico City. We're still deciding. Most of us are going for Cancun, but let's see.
I mean,
And
Mexico City is beautiful. So
is there a website that people can find out about it? Is that up
um,
yet?
no, it's not updated. It's drSF.com, but it's not up there yet. But it's gonna be on Instagram, Dr. SFG.
great. Ilana, tell me, do you have any other questions?
Yeah, one of the things we ask everybody is, what is your favorite injection? Is there a neural therapy injection that you pull on more than any other injection? And I know it's a completely unfair question, and everybody has told us it's an unfair question, but we still keep asking it. Do you have a favorite neural therapy injection?
I have so many favorite injections. I was just thinking because I was injected so much with the accident. I know every single injection, how much they hurt, what do you feel? But okay, I have two favorite. My favorite is abdominal fascia. So it's not just one point, but it's the way I do it is I speak to a person when I see their energy shifting. Like if I ask you, Lana, like what brings you here? Oh, I have, I don't know, like anxiety and I feel something in my chest. Then we go there through breath work and when I put my hands on the abdomen, I can feel exactly where the tension is. And then we go like it's almost like surgery, just going to the event, not the happy event, but the negative, big, dirty emotion that's having you stuck. We go through breath work. I hold you there, and then we give the injection. It's magical because immediately you feel relief, and the body starts speaking. So the person will say, "Oh, I also feel that here, and this is related to my mom, and this is related to my husband, and this is related to all the issues," and we just like to take them out of body. That's one of my favorite. And my other favorite would be maybe stellate ganglion is because it has so many deep or this new vagus technique. I'm just crazy about it because this vagus technique, I felt it on my pelvis, but I also felt it on my legs, and I was like, wow. Unfortunately, I don't get it too often because I can't inject myself. But this is why I come to conferences so much so I can get colleagues to inject me.
Yep. Yep.
And
Can you
hopefully we can teach these techniques. I was talking to Dr. Michael, and hopefully we can bring this to the US. We were talking about having something in New York where we can teach this mental health injection techniques that are basically holistic, coming to the world, and also tracking HIV.
That sounds amazing.
Wonderful. Yeah.
Can you tell our listeners where to find you? Do you have a website? What's your Instagram handle? Just so people can keep on following your work and see you.
Thank you. Sure, it's drstep.com, or I think that the easiest way would be Instagram that keeps updating the clinic services at Dr. That's where we post our podcast interviews, um, whatever comes from conferences, workshops, all of that.
Well, thanks so much for joining us today. It was really, really great to hear what you're doing. It sounds
And
like you're just
very
doing really amazing
inspiring.
work. I want to come hang out at one of your retreats.
And I definitely want to inhale exosomes. For sure,
I
I
want
want
to
to
inhale
inhale.
exosomes too.
You do. You do. Please come. It's gonna be fun because it's an all-inclusive retreat and it's healing the healer. So yes, we learn a lot of techniques. Yes, we learn a lot of theory, but we also have fun and we also inject each other and we also have therapies for us. So we usually never stop as healers. We're always like seeing people work and we don't stop for ourselves. And if we do this, it's gonna be an all-inclusive resort on the beach in a beautiful environment. We will work, we will have fun, we will learn from joy also, and we will have this beautiful acid and cherry on the cake that will be, how do we market this? How do we learn to communicate this? And why is it important? Because we're doing so much work every day. We could really change the world, but it's not a single effort. So this is all like the bundle. I hope you can come. It's going to be amazing.
Wonderful.
Thank you so much. We really, really appreciate your time. And we can't wait to share with our listeners exactly who you are and what you do, because it is very inspiring.
Thank you so much.
Thanks so much, everybody. Bye.
Hey, bye.
Thank you.